Hi, I'm Yulin Hswen, Associate Editor of JAMA and JAMA Plus AI, and you are listening to JAMA Plus AI Conversations. My guest today is Dr. Robert Rudin, a Senior Information Scientist at RAND and a Professor of Policy Analysis at the Pardee RAND Graduate School. He researches digital health innovation with a specific focus on clinically integrated interventions, such as between-visit monitoring using patient-reported outcome measures. Welcome, Robert.
Thank you. Great to be here.
So, in your article, Between Visit Symptoms, Monitoring in Asthma, a randomized control trial of a scalable digital intervention in primary care in JAMA Network Open, you tested a phone app to help people with asthma track their symptoms. Can you tell me a little bit of the background of why you developed this app and the reasons for it?
Well, the core reason, which I started about 10 years ago, was because the guidelines for asthma actually recommended and still recommend to track symptoms. But in practice, relying on the patients to do that themselves is not very reliable. Most people don't do it. So it was to make it easier for the patients to do it and easier for the data to be used as part of clinical care also.
Can you tell me a little bit about how patients use this application and the benefits of it?
Sure. And we've developed this app over many years with several rounds of user-centered design, getting a lot of good input from patients with asthma, as well as pulmonologists, as well as primary care doctors. And what we've learned from all these conversations and all these user sessions is that the main mechanism of action for this app is essentially that a lot of patients with asthma go through their lives, they have some exacerbations, they have some symptoms, but a lot of times they're not really thinking about it. They just get a little worse, and then they might think, oh, should I call my doctor? But we heard over and over again that they say, oh, I don't want to bother my doctor. And then their symptoms get worse and worse, and then they end up in the emergency room, or they end up with a really severe problem. And what this app does is it's very simple. It just asks them essentially how they're doing, 5 standardized questions, and it makes them more aware of their symptoms. And when they're more aware of it, then it makes it easier for them to recognize when they have a problem and a flare up. And also, the app helps make it easier for them to request a call from a nurse in their clinic so they can get help more easily.
And with all these new AI tools, such as generative AI, do you see any new developments in your application that you could integrate?
Absolutely. I can see 2 different ways where some AI can come into play. One is that the AI algorithms are only going to be as good as the data that's used to create them. And having individual data from patients between visits could be potentially very useful, feeding into algorithms to help inform treatment plans, to help patients decide when they need to get care. So that's one potential as a source of data. And the other is once you have patients on board where they're answering these questions in between visits, then you also have kind of paved the last mile, so to speak. You have an app in their hand that they're using all the time. Ours is once a week, which if you have other patient-specific information that you'd like to deliver to them, you can do that in the context of their routine use of the app. So it provides both the mode of delivery and it provides better data that could be used for potential future algorithms.
So tell me about your research in this area of in-between visits and the importance of it.
Right. So the amount of time that patients spend with their doctor or nurse in a visit is very small compared to the amount of time they're actually living their lives. And usually you go to the doctor and then they say, tell me what's wrong. And then you're expected to summarize everything that you've done in a minute, maybe 2 minutes, maybe a few more minutes if you're lucky. And that's really tricky. So one thing what we've heard from some of the patients and the doctors who've used this system is that when they go back and they can take a quick glance at the graph of the patient questionnaire responses, and they say, oh, what happened here on January 3rd? And the patient would say, oh, yeah, I had an exacerbation then. I forgot all about that. So it can help actually paint a more holistic picture of what was really going on in the patient experience during that time. People's memories just aren't really very good. So when you ask how things are going, now you can actually have some data to inform that answer rather than just relying on people's imperfect memories.
So, how can this be integrated into clinical systems?
So probably the biggest way it could streamline clinical care is to prevent clinical issues from deteriorating in the first place by making patients recognize the symptoms when they have them. So the intervention is designed as both a patient self-management intervention and a clinical intervention. But the idea is to basically allow the patients to do as much as they can on their own. So give them the tools they need, but also have this light, clinical oversight where when they do need help, allow them to get the help. So there's tons and tons of apps out there in the App Store that are completely unintegrated from clinical care. So you can download an app, you can download a bunch of apps for asthma, you can download apps for you name your condition. But most of those apps, you're kind of on your own. So a lot of patients lose motivation. They don't really know when to call their doctor. Sometimes the app will say, oh, call your doctor. But then they're still kind of on their own to figure out if they really need to call their doctor or who they need to call. Maybe not sure if they need to call a specialist or primary care doctor. And it's not as good a user experience. And they also aren't likely motivated to use it because it's not necessarily recommended by their doctor. Whereas this intervention we developed, it's specifically designed so that the doctor or nurse recommends it and says, this is part of care, use this. And we also, importantly, a critical part is we tried to design it very low burden on the clinical team because they're busy and they don't have time to do a whole lot of extra work. Like they're not expected to review these weekly symptom reports. That would be not a scalable solution. So we tell the patients straight out, we say, your clinical team is not reviewing this regularly. If you need help, it's your responsibility to get help, but the data is available to them. And during their visit, the data is right there in the electronic health record. So we've tried to thread the needle in that sense.
And tell me what the barriers were in terms of the digital access, if you had any patients that had trouble with using the application.
Sure, that's always going to be a bit of a problem. There's never going to be a technology solution that covers every single patient. And there are substantial numbers of patients who don't have internet access, aren't very good at using these tools. For those patients, we do think there's a good potential to have their caregivers use the tools for them. And that wasn't a major part of this particular trial, but I do have some hope that any patient who has a caregiver would be able to make some use of this tool. That still doesn't cover everyone, but hopefully we can address all these different types of patients and their needs. So in terms of usage, though, for the patients who did have a smartphone and started using the app, we got a lot of reports from our analysis and from our other study that said that the patients found it very easy to use. And really, it's because it was just answering 5 questions every week and then a few other questions based on that, such as, would you like to request a call from someone in your clinic? We had several other features available in the app, such as ability to record your peak flows, ability to take notes, but we found that not that many patients used it. The ones who did found it very important. But you don't need to use those features necessarily to get the benefits from the app. It's really the core benefit is very likely just being more aware of your symptoms.
And how did you go through the user design? Can you talk a little bit about that process? Because user design is very important. And we find that a lot of the time, clinical tools for patients aren't always very easy to use, but there's obviously success here.
Yeah, and I'd really attribute the high percentage of users who continue to use the app at the end of 12 months, which we had, I think, almost 80% of the patients continue using the app at the end of 12 months, which is very high for digital health apps. And I attribute that rate of usage entirely to our user-centered design process. And what we did essentially is we did something a little, this should be more common, but it was maybe a little unusual, is we went back and forth between the patients and the doctors or nurses, doctors and nurses actually. We went back and forth between them in our design session. So we interviewed a bunch of patients and told them what we were thinking about. And then we went to the doctors and nurses and they said, oh, well, I don't have time to respond to all those alerts. And we said, okay, well, let me go back to the patients and ask them. And we kept going back and forth. And one of the big revelations that came to us was that when we started, we kind of were thinking of a more traditional model where the patient's job is to supply the data and the care team's job is to make the decisions based on the data. And it became pretty clear during our initial trial and then our testing that the patients actually, a lot of times, they didn't want to have all the decision making be at the provider. Like they felt they could make a lot of decisions on their own and they wanted to be empowered to do that. So we said, okay, that's fine. You make the decisions, except when it's really, really bad, when you have very severe symptoms, then we won't let you make the decisions. We'll just report that. And in our trial, we found actually that none of the patients liked that. They still wanted to make the decision for themselves, even if they were reporting severe symptoms, because they may have already called their doctor or they may have thought it was under control. So, well, that was great for a scalability perspective because we didn't want to send any requests for calls if they didn't need them. So we removed that feature, and it turns out when we scaled this to primary care, we initially started it in pulmonary care because it was easier to recruit patients. Then when we scaled to primary care, we had so few requests for calls. I think it ended up being about less than 3% of the time where we offered a call did the patient say, yes, please give me a call. And they may have called outside of that on their own, but some evidence suggests that we didn't induce a lot of extra utilization, and most of the benefit came from patients just being more aware of their symptoms.
So what do you see for the future for this asthma application, and will you translate the type of user interface to other diseases?
Yes, there's ongoing work, which I've been a part of and we've published on in rheumatology, rheumatoid arthritis in particular. There's a great use case there. I think there's a lot of other, especially mental health conditions. There's opportunities there, which I haven't looked into. There is already work in active cancer that's separate from what I've been working on. That's pretty widely established. So that's a place where symptom monitoring is doing pretty well. And I think that'll approach the standard of care there. But I think in terms of chronic diseases, there's a huge amount of opportunity. And ultimately, what I would really like to see is every single person on the planet to have some kind of regular check-in between visits. And if they're really healthy, maybe the check-in is just to make sure they know some basic health knowledge and are exercising. And if they have a lot of complex conditions, they should have questions tailored to them. And we have a lot of work to do to get to that point. But ultimately, having some app that just kind of helps you out and queries you about your symptoms every so often and asks you how you're doing and helps you get what you need when it comes to care and patient education. That's where I hope we're going.
Thank you so much, Bob. I really appreciate you being here.
Thank you. Great to be here.
I'm Yulin Hswen, Associate Editor at JAMA and JAMA Plus AI, and I've been speaking with Dr. Robert Rudin on the role of digital interventions for between-visit symptom monitoring in asthma. You can find a link to the article in this episode's description. And for more content like this, please visit our new JAMA Plus AI channel at jamaa.org. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.